Welcome to the iSalus Healthcare 2014 Meaningful Use Stage 1 Training and Informational Video. During today's training, I will briefly cover all of the Stage 1 Meaningful Use objectives and show you where in the system you can keep track of and monitor how you are doing with meeting the objectives in real time. After the video, if you still have questions or if you'd like to dive a little deeper into each Stage 1 objective, you will absolutely be able to search through the OfficeEMR knowledge base to locate and then view a quick use guide on each and every one of the Stage 1 objectives that we talk about here today. The quick use guides are meant to provide you with a more in-depth look at each objective and to show you step by step what in OfficeEMR you need to do in order to successfully meet an objective. And the OfficeEMR knowledge base that I'm referencing is just right here in the upper right-hand corner of your screen where you have your search box that says OfficeEMR Search. If you just click inside of there once and actually just type in there MU Stage 1 and hit Enter, you'll get a window that will automatically pop up, and here's going to be a list of all of the quick use guides that are going to be set up for you for each and every objective that we'll walk through during our training today. So for example, if I had a question or wanted to dive in a little bit deeper onto the allergy list objective, I could simply click here on our quick use guide for the allergy list, and at that point our system will bring up a PDF guide that will contain all of the information you need to know in terms of what the allergy list objective is, what the threshold is, and then how step by step in OfficeEMR you'll be able to basically meet that particular objective. So we'll go ahead and close out of all of our OfficeEMR search boxes there, and we'll go ahead and kind of get started with the formal part of today's Meaningful Use Stage 1 training. So in OfficeEMR, basically the main way that you'll kind of use our system to kind of track in real time how a certain provider is doing in terms of meeting meaningful use objectives is through what's called the provider dashboard. So within our system, we actually have a provider dashboard that we'll take a look at here in just a second. That'll basically, once you have added a provider to the dashboard, you'll be able to come back to this dashboard at any point in time throughout the day or through the EHR reporting period and literally see in real time how your provider is doing in terms of meeting all of the different objectives. Okay? So where you'll want to go in our system to actually access the provider dashboard is the reports section or module of the application. So in the lower left-hand corner, I'll go ahead and click on our reports button once. Okay? And then on the left-hand side here, directly above your quick launch buttons, where you have all of these different options, you'll just want to actually scroll down towards the very bottom of that list. And here underneath the Meaningful Use heading, you see we have an option here called Provider Dashboard. So we'll go ahead and click on that once to pull up our dashboard. Okay. So what will basically happen, or what we're looking at this point, is up here at the top we actually have the dashboard, which is completely blank at this point in time. And then down towards the very bottom of the dashboard, we see a list of all of the providers who at some point in the past were already added to the dashboard. Okay. At this point, if we were wanting to kind of pull up the dashboard for somebody who you had already added at some point in the past, so maybe Ann Chapman here, for example, we've already added Ann to the dashboard at some point in the past. So if we were just wanting to kind of pull up and see how Ann is doing currently in real time for meaningful use, we could just click on her name once from the list of providers at the bottom of the screen, and at that point our system will actually pull up or load the appropriate stage dashboard for you, and basically from there, once you're viewing the dashboard, you'll be able to see a button there for all of the different objectives. And I know some of the buttons are lit up in green and red and orange, and I'll explain all of that here in just a second, but I just want to kind of show you, once you've get to a point where you've already added your provider or multiple providers to the dashboard, in order to pull one of those up and see how they're doing in real time, you would just simply click once on their name at the very bottom of the screen. Okay. What I'll kind of walk you through here next is a scenario where we basically need to add a new provider to the dashboard. Okay. So the way you add a provider to the dashboard is you'll come down here and towards the bottom of the screen here, across this kind of middle portion, you've got a series of different buttons there. And the button you'll want to click on to add a new provider is a button that looks like a little doctor in a white coat with the green plus sign. So we'll click on our Add Provider button once, And then when you do that, you'll get this Add Providers window that'll pop up here in the upper left-hand corner of our screen. So in the upper portion of this window, we're going to have a list of all of the providers that are currently set up in our database. Okay? For most of you, you're not going to see a list this extensive. You'll just see, the one or two or handful of providers who actually work out of your database there. But since we're kind of in a demoing database, we're kind of seeing a big list here. So you probably won't see this many providers when you log in, but we'll just kind of run with it. In our case, we'll just say maybe we're wanting to add in there Dr. Christy George to the provider dashboard. So I'll go ahead, and the first thing I'm going to do is I'm just going to click once on the provider who I want to add to the dashboard. Okay? And just so you know, you'll only be able to add one provider at a time, so you won't be able to kind of come in here and select multiple providers and set them up all at the same time. You will need to add each provider individually. Okay? So again, we'll click on the provider's name and there at the top of the list first, and then the next thing we'll need to do is down here at the very bottom portion of the window, we'll just basically need to fill in the rest of our kind of criteria for this provider. So the first thing we'll need to do is select the year that we're planning on attesting for meaningful use. Okay? So we'll just go ahead and select this year as our first year, or this could be your second, third, or fourth year of meaningful use. Basically, you just want to select what year you're currently in. So we're currently in 2014, so I'll go ahead and select that. And then the next thing you'll need to select is what stage of meaningful use are you in. Okay? For today's training purposes, we're going to walk through ONC 2014 Stage 1. Okay? If you are ready for Stage 2 or think you are, please reference the iSalus Healthcare 2014 Meaningful Use Stage 2 training video for information on that. Okay? So we'll go ahead and select ONC 2014 Stage 1 as our stage. And then the next thing we'll need to select is our program. So that's going to be whether you're either testing through the Medicaid or Medicare program. For example purposes here for training, I'll just kind of point out a couple of important things. If you do plan on attesting through the Medicaid program, one thing you'll want to be aware of is that once you select Medicaid as a program, here in the period, you'll want to select 90 days instead of a full year. So basically, CMS has come out, and for basically the entire year of 2014, regardless of whether you've attested for meaningful use in the past or you have not, whether you're in Stage 1, Stage 2, it doesn't matter. Everybody in 2014 is basically going to do a 90-day period. So Medicaid, Medicare, Stage 1, Stage 2, doesn't matter. Your period for everybody in 2014 is going to be 90 days. So you want to select 90 days as your period. Okay? And the big thing I want to kind of point out here is your start and end dates here. So if you go through the Medicaid and you select a 90-day period, if you're Medicaid, you have the ability to choose when you want your start date to be for that 90-day period. Okay, so you have the ability to choose that. One thing I'll show you here in just a second is if you are going through the Medicare program, you don't have the luxury basically of selecting when you want your 90 days to start. You have to start at the very beginning of one of the 4 quarters throughout the year. Okay, so that's kind of the main difference I'm getting at here. But again, I'll just kind of point that out and show you. So once you've selected Medicaid, selected a period of 90 days, you now have the ability to set what you want your start date to be by clicking on your little calendar icon here, and then you have the luxury of basically going through, and if you want to start on January 27th as your start date, you can go ahead and select that, and our system will automatically calculate your end date there for you. Okay. One other important note that you'll want to make sure you're aware of is if you are testing for the Medicaid program, and since you are able to select your own start date, please make sure you are selecting a start date that is after January 10th of 2014. Okay. Going back, so now I'll just kind of walk you through here next the Medicare portion. So again, what you'll see is if we change our program now from Medicaid to Medicare, okay, we'll still need to select a period, but this time it's going to be either the option to start at the beginning of quarter 1, quarter 2, quarter 3, quarter 4. Okay. One thing I want to make note of here on the Medicare side is here in the period, you'll want to make sure you're selecting quarter 2, quarter 3, or quarter 4. Okay. You won't be able to select quarter 1 because iSalus Healthcare, we as a company, we actually didn't receive our ONC certification until January 10th. So that's why basically if you selected a Q1 as your period, since some of the days of that 90-day period would be before we had received our certification, your attestation would then be invalid. So make sure if you're doing Medicare, you're selecting Q2, 3, or 4. And then again on Medicaid, make sure you're selecting your start date after January 10th so that everything is valid in your attestation. So we'll go ahead and select Q2 as our start date here for Medicare. And then basically what you'll need to do for Medicaid or Medicare then is select what vital signs you'll want to basically go after or try to attest for the 90-day period as well. Okay. So by default, what everyone should know is basically you should be selecting the height, weight, and blood pressure alternative. That should be what you select, unless for certain instances and based on your specialty, if you were to feel that a blood pressure does not fall within the scope of your practice, it's not really relevant to what you do. In that case, if a blood pressure isn't in your scope of practice, you would be able to select that you just want to capture only a height and weight for your patients. Okay? And then on the flip side, if you feel that a height and weight are not relevant to your scope of practice, but only a blood pressure is, you could then in that situation select to only capture a blood pressure. Okay? Otherwise, if you feel all three of those vital signs fit into your scope of practice and what you do, you'll want to make sure you're selecting the height, weight, blood pressure alternative. And then just so you're aware, this height, weight, and blood pressure, the kind of plain option there for those three, the reason that is there is so that if you ever needed to kind of retroactively go back and run some meaningful use numbers from a previous years, you'd be able to do that. Okay? But for 2014 and moving forward, you'll want to make sure you're selecting the height, weight, blood pressure alternative. So we'll go ahead and just select that. So now that we've selected our provider, Christy George up top, filled in our information down here below, to actually fully add Christy to the dashboard now, we'll go ahead and click our OK button once. Okay? And now if we look into our list of providers here that have been added to the dashboard, we now see Christy George's name. And then again, if at this point we wanted to actually see how Christy is doing in real time in terms of meeting these objectives, we'd be able to click on her name once in the list, and then her dashboard would light up with the various red, green, orange colors to kind of let us know how she's doing currently in terms of meeting the different objectives. Okay. So to kind of get started there, I guess I'll kind of start off with the different colors since we kind of see that right off the bat, and I'll let you know what that basically, what that is kind of symbolizing, I suppose. So any buttons that are listed there, each of those buttons basically represent a different objective that either needs to be met or you have the option to kind of not meet. And I'll get into that in just a second. But just so you know right off the bat, all of those buttons there, the ones that are listed in red, those are basically objectives that you are currently not meeting. So we see a lot of red on here, and that basically is letting us know that Christy is not doing very well at this point in time. She's not meeting a lot of these objectives. The buttons listed in green are signifying the objectives that Christy is currently meeting. So as you can see there, we've got 3 of those buttons currently lit up on the dashboard. So those 3, Christy is currently meeting. Another color button you may see is orange. Whenever you see an orange button, that basically means that you're close to meeting the objective, but you're not quite there. You're basically within about 5 or 10% of the goal threshold for what you need to be meeting for that particular objective. So orange basically means you're close, but not quite there. Okay, so that's what all the different colors mean. The next thing I'll kind of explain and walk you through there is basically the 2 different sections of the dashboard itself. So within Meaningful Use, they basically have a core set of measures, and those are all fall into the upper portion of the dashboard. So everything here from problem list down through smoking status, and then over to the right and up through clinical summary, timely access, and then back to the left of problem list. Everything here in this upper portion, these are your core objectives. And the core objectives all must be met by you in order to successfully meet in a test for meaningful use stage 1 in 2014. Okay. With that being said, there are certain exclusions that some of you may qualify, in which case you would not have to meet those particular core objectives. And as we go through our training here today, I'll point out which of those objectives there are exclusions for. The bottom portion of the dashboard, we then get into our menu set. So I'm talking about everything here from the RX formulary down through MedRec, and then over to the right through patient reminders, patient list, up to immunization registry, and then back through lab results and back to RX formulary. Everything here in this lower portion, this is your menu set. These are basically 10 additional objectives or measures that CMS has put out there for stage 1 of meaningful use. And as the name sort of implies, there's a menu set. You only have to meet 5 of these 10 objectives. So you don't have to meet all of the menu set, only 5 out of those 10. And again, I'll kind of walk through those, and there are even certain menu set objectives where there are exclusions that some of you may qualify for as well. Okay. So at this point, what I'll kind of do is I'll just literally walk through each one of these objectives, starting with our core objective set, and I'll kind of explain how you can, from the dashboard, pull up and view a description of each objective, what you need to do, and then down to the future, I'll kind of show you how, if you wanted to see what all patients are currently not meeting that objective, I'll show you how you can see all of that information from the dashboard, and then I'll also kind of quickly run over it here in the system or within OfficeEMR how you would actually meet that objective for a patient. Okay. So we'll start in the upper left-hand corner with the problem list objective. So I'll go ahead, and what you can actually do for any of these objectives that has a button here on the dashboard, you can actually click on the button itself, and when you do that, you'll get this nice little window. It's going to pop up for you automatically, and it's going to give you the kind of rundown on that particular objective. Okay. So within each of these windows, you'll always have a section here for the measurement, the implementation, the exclusion, if there is one, and then your measurement. Okay. Essentially what this is the first section at the top is the measurement. That's basically the language straight from CMS on what this particular objective means. Okay. The implementation section, what that essentially is us at iSalus Healthcare taking that CMS language and kind of translating that into what you need to do within OfficeEMR to meet that objective for a patient. Okay. The exclusion section, obviously if there is an exclusion for this objective, you would see that. In our case here for the problem list, there is no exclusion for this. So everyone must meet this problem list objective if you plan on successfully attesting for meaningful use stage 1 in 2014. Okay? And then your measurement section, what's important to here is this is where you'd actually be able to see in real time how many patients you've seen within your 90-day reporting period so far, and then of all of those patients you've seen so far, how many of those patients currently meet this problem list objective. Okay. So since Christy, we kind of started her reporting period, doesn't even start until April 1st, and we're here in March still, so that's why we're kind of currently seeing zeros there in our numerator and denominator, because Christy hasn't even really seen any patients in April yet. Okay. The goal here in the problem list objective is 80%. So essentially what this basically means is that for 80% of the total patients that Christy sees in the 90-day period, 80% or more of those patients need to have at least one entry on the problem list screen that is either active or resolved. Okay. So what that basically means, and I'm going to jump into the EMR here real quick to show you what I mean. So in the EMR portion of the application, click on our EMR button in the lower left-hand corner. In the EMR portion of the application, here on the right-hand side in your chart tabs, you have a chart tab here called Problem List. So this is basically intended for you to kind of keep an ongoing list of any chronic conditions that you as a provider are actively treating, or if you just want to make sure that you're aware that a patient has, hypertension or cancer or something like that. You just want to be aware and know that they have it. So you can put that issue or problem on the patient's problem list as well. So this is what they're talking about. So for this particular objective, 80% or more of the patients you see, they need to have at least one problem on their problem list that is either active or resolved. Okay? So all you need to do to potentially meet this objective is actually go into their chart in the EMR and then click on your problem list chart tab on the right. Okay? And then, for example, if we wanted to come in here and maybe say that our patient has hypertension. All you would need to do is in your add problem search box to type in this at the top of the screen, type in hypertension to search for it. Okay. You'll get all the different versions of hypertension you're looking for. If we're just looking for benign hypertension, the disorder, we'll go ahead and select that in our search results by clicking on it once. And then from here, we'll just click OK, and then click our purple Save button at the top of the screen. So at this point, this patient, since they now have at least one problem on their problem list, this patient now meets the objective for meaningful use. Okay, so if Christy actually saw this patient here in April, we had this problem on the problem list, this patient would fall into not only the denominator, but also the numerator. So we would be 1 for 1 or at 100%, which is greater than the 80% threshold. So we would be meeting that objective at that point. Okay. One thing I'll point out here real quick is if you do have a patient who, they're very healthy, they don't have any problems or issues going on, what you can absolutely do to kind of quickly designate or mark in their chart that they do not have any problems is you can actually come over here to the Summary Chart tab on the right-hand side, click on that once, and in this Problem sections here on your Summary Chart tab, where it lists out our benign hypertension, if this patient did not have any problems and we knew that up front, what we could have done is instead of going to the Problem List Chart tab, we could have just right here from the Summary clicked on this little tab here from the Problem section and then selected this option here called No Known Problems. And at that point, it would add no known problems to the patient's problem list, and that will absolutely qualify for meaningful use for the problem list objective. So that'll work. So you can absolutely use no known problems as a problem on the patient's problem list. Okay. So that is the problem list objective. So I'll go ahead and flip on back here to our dashboard to pull that back up. Okay. And again, once you kind of read the description there, one thing I'll point out here before we close out of this is if you are ever at this point, you're a couple weeks in to the meaningful use to your 90-day period, and you see that you're currently only at 60% and the goal is 80%. What you can quickly do to kind of quickly pull up a list of all patients who are missing this objective is you can actually click on this blue Patients Missing Objective link in the lower left-hand corner of this window, and at that point our system would pull up a list here of all of the patients who are missing that objective. You'd be able to click on their name from the list. It'll take you into the EMR, into that patient's chart in one click, and then at that point you'd be able to add in, if they did have any problems, you'd be able to add those in. If they had no known problems, you can make that designation as well. So this would be a nice tool for you to quickly pull up a list of all patients missing this objective, so you're not having to kind of guess or look around and spend a lot of time figuring that out. You just be able to click on this link to quickly pull up this list of patients. Okay. So we'll go ahead and close out of that. One other thing I'll point out that you can use if you'd like is here at the very bottom kind of center portion of the window here. For each objective, you'll also have the CMS objective documentation link. And what this will basically do if you click on that is it's going to take you out to the CMS website, and I'll actually pull up the details straight from CMS for this particular objective, so you'll be able to see what CMS has to say. So you can absolutely look at this information if you'd like, and then again you'd absolutely be able to click on your Patients Missing Objective link as well. Okay? And again, each of these two links are going to be available on each and every one of these objective buttons that you click on. So even though I'm about to click out of the problem list objective, you'll see here in just a second, once I click on the Vitals button, you'll still see those two blue links that obviously would pull up the list of patients missing for the Vitals objective, and then it would take you to the CMS documentation for Vitals. So we'll go ahead and click on the Vitals button here next to pull up this and see what we've got going on. So again, we've got our measurement section, the implementation section, the exclusion section, and then of course our measurement as well. Okay. So a couple of notes you'll want to kind of pay attention to here on the Vitals objective. So some of the wording and some of the qualifications, so to speak, have changed from years past for stage 1 of meaningful use. So one thing I'll kind of point out here is the height, weight, age change that has taken place. So between the years of 2011 and 2013, a height and weight needed to be recorded for all patients who were aged 2 and older. Okay, so that used to be the requirement. Starting in 2014 and moving forward, a height and weight will need to be recorded for all patients of all ages. So basically, as soon as a patient is born, they come in for a visit, you need to start capturing a height and weight. Okay. Another change that has taken place is for the blood pressure age change. For the years 2011 through 2013, the blood pressure needed to be recorded for all patients aged 2 and older. For 2014 and into the future, a blood pressure will only need to be recorded for all patients aged 3 and older. Okay, so you'll no longer have to record a blood pressure for your patients who are 2 and younger. So going forward, you'll need to do that for patients aged 3 and older. Okay. A couple of other things I'll kind of mention here up front as well, because it kind of goes hand in hand with the new age changes or your exclusion changes. So basically here, starting in 2014, if an EP, if an eligible provider, if you see no patients 3 years or older, you do not have to record a blood pressure. Okay? If all 3 vitals are not relevant to the scope of your practice, you do not have to record any of the 3 vitals. So that is one of the exclusions. And then again, a couple of these other ones we've already touched on a little bit. If a height and weight are not relevant to your scope of practice, you do not have to record a height and weight. You would just only need to record a blood pressure. And then kind of on the flip side of that, if a blood pressure is not relevant to your scope of practice, you don't need to capture a blood pressure. You would just need to capture a height and weight. Okay. So that's kind of the changes that have taken place with the ages and the exclusions. But basically, once it gets down to it, what you essentially need to do here for the vitals objective is that for 50% or more of all the patients you see during the 90-day period, you need to make sure you're capturing for them a height, weight, and blood pressure on the vitals chart tab in the EMR. Okay. So again, just to kind of quickly recap and show you where that is, if we jump into the EMR here real quick, here on our right-hand side in our vitals chart tab, if we click on that once, okay, and I'm just going to collapse this navigation column down so we can see that a little bit better. There we go. So here on your vitals chart tab, again, for 50% or more of the patients you see during your 90-day period, you're going to need to capture a patient's height, a patient's weight, and at least 1 blood pressure. So it doesn't matter what kind of position the patient may be in or anything like that, so whether they're sitting, standing, or in the supine position, you need to make sure you're capturing at least 1 blood pressure and then a patient's height and weight, and then have that saved in their chart. Okay. As long as you're capturing those 3 vital signs for 50% or more of your patients, you'll be able to meet that vitals objective no problem. Okay. So we'll go ahead and jump back to our dashboard. All right, and then again, here in the vitals window here that we have pulled up, again, you still see you have that link there to pull up patients missing objective. So if there are any patients who have not met that objective, you'll be able to quickly pull up a list of those patients by clicking on that link. And then again, you'll be able to click on your CMS objective documentation to go out to the CMS website to pull up CMS's information for the vitals objective. Okay. So we'll go ahead and close out of that and move on to our next objective. Okay. The next objective we have here is for the demographics. So we will go ahead and pull that up and take a look at what we've got in the window there. So basically what this objective is stating is that for 50% or more of all the patients we see during the 90-day reporting period, we need to make sure on the patient setup window in our system that you're capturing the patient's preferred speaking language, gender, race, ethnicity, and date of birth. Okay? So we need to make sure we're capturing those 5 pieces of demographic information in the patient setup window. And again, to quickly show you where that is I'll just hop in here to the iScheduler real quick. And if I pull up the patient setup window here for our patient, okay, and if I go down to the demographics tab on the left, what you'll want to make sure you're capturing for your patients for the demographic objective is basically the patient's preferred speaking language, which will be here towards the top of the demographics. Okay, so if you want to quickly go down there, we'll just say that Billy's preferred speaking language is English, so we'll go ahead and select that. We've already captured the patient's sex or gender and their date of birth, so the only other two things we need to capture here in demographics are the patient's ethnicity and race. So here on the ethnicity drop-down, you have the option to mark off whether the patient is not Hispanic or Latino, Hispanic or Latino, or if the patient declines to specify, you can now mark off that as an option. Okay? So we'll just say that Billy declined to specify, and then on your race, you have the ability to choose whether the patient is white, Native Hawaiian, or other Pacific Islander, black or African American, Asian, American Indian, or Alaskan Native. And then again, you do have the option as well here to select whether they decline to specify. Okay? One thing I'll point out here on your race list is if you do have a multiracial patient, what you can do to select multiple races is you can basically hold down the control key on your keyboard, and as you hold down control, go ahead and at that point select individually the races that that patient happens to be. Okay? And if you ever need to unselect them, you just click on the same option while holding down control. We'll just say that Billy declined to specify a race as well. So at this point, now that we've got the patient's ethnicity, race, gender, date of birth, and preferred speaking language filled in, we'll now go ahead and click our purple Save button here to save that in their chart, and then we'll go ahead and close out of our demographic or patient setup window, and at that point, our patient is fully compliant in meeting the demographics objective for Meaningful Use Stage 1. Okay. So we'll go ahead and jump back into reports and go back to our dashboard. And again, just to recap here on the demographics, you need to make sure you're capturing those 5 pieces of demographic information for 50% or more of all patients you see during the EHR reporting period. So we'll go ahead and close out of that window, and we'll take a look at our next objective. So the allergy list objective, we go ahead and click on the allergy list button to pull up that window. The way this works is basically very similar to the problem list objective we just take a look at. So here on the allergy list, your goal is 80%, just like it was for problem list. So for 80% or more of the patients you see during the 90-day reporting period, they need to have at least one entry on the allergy screen in the EMR. Okay. So we'll go ahead and just to recap and show you real quick what you need to do, we'll jump into the EMR real quick. And basically from here, in your list of chart tabs on your right-hand side, you'll want to make sure you go to the allergies chart tab. Okay? And then from here, it works just like the problem list. You'll just want to search for the allergy that the patient may have. Okay? So if Billy Walsh here, for example, is allergic to amoxicillin, our system will go out there and return to you a list of all of the results that match your search, and we'll just from here again click on amoxicillin from our search results once, and then in the symptoms there, if you want to fill in any associated symptoms the patient may experience, so maybe if they accidentally take amoxicillin and they break out in a rash or hives or something like that, you can fill in those associated symptoms if you'd like, or you can leave those blank and then just hit OK, and then hit your purple Save button at the top of the screen once to save this to the patient's allergy list. Okay? So again, just like the problem list, here on the allergy list, you only need to have at least one allergy added on 80% or more of all the patients you see. Okay? One other thing I'll show you here real quick, just like it was for the problem list objective, if we go back here to the summary chart tab in our allergies section where it has amoxicillin now listed, if we knew up front that this patient did not have any allergies, in order for this patient to successfully meet the allergy list objective for meaningful use, we would want to click on our tab here for allergies and select this no known drug allergies as our option to add that to their patient's allergy list. So no allergies will actually work and qualify as a valid option on a patient's allergy list. So we'll go ahead and jump back into our provider dashboard. So I'll click on reports, and that'll bring us back to where we left off here on the allergy list. The next objective we have here is the first one is actually lit up in green for us automatically. So this one called RX interaction. So this is actually a freebie, so to speak, in terms of the objectives that you have to meet. So all that's going on here on the RX interaction is basically throughout the entire 90-day reporting period, you need to make sure that the RX interaction settings are turned on in your database. And this is actually something you should never have to worry about because by default, these settings are always turned on. So there's nothing special you need to do here for this objective. Just by you inherently using our software to do all of your clinical documentation and do your meaningful use reporting and attestation, by you using us, you're going to automatically meet this objective. So there's nothing special you need to do here. You're going to get this one automatically for free. Okay? So we'll close out of that one. The next objective we have here is the med list objective. So we'll go ahead and click on that once to pull up the window for that information on that. And just like the problem list and allergy list objective we saw before, this medication list objective is very similar to that. So again, your goal is 80%. So for at least 80% of the patients you see during the 90-day reporting period, at least 80% of those patients need to have a medication on their medication list that has a status of either new or recurrent. Okay? So what this basically means is we'll go ahead and jump into the EMR here real quick. Okay? And I'll collapse that down. So what we can do up here, I'll kind of do this a little bit reverse from how it did the allergies and problems. So if you knew up front that a patient does not have or is not taking any medications, what you can do to quickly mark off the patient as no known medications and add that to their medication list is right here from the summary chart tab. You'd be able to click on your tab that's hanging down and select no known medications. And at that point, that patient would absolutely be in compliance with the medication list objective. Okay? If the patient is taking medications or you are prescribing something to the patient today for their visit, you'll again do all of that from the prescriptions chart tab here on the right-hand side. So if we come down here to prescriptions, click on that once, that's going to pull up our prescriptions chart tab for us. Okay. And then what we'll go ahead and do is we'll just say that Billy Walsh here, he tells us that he's currently taking, we'll just say Allegra Allergy. Maybe he has some allergies, so he takes Allegra Allergy every day. It's a current medication that he's taking. So what you want to do to add that medication to the patient's medication list is just perform a drug search or select the appropriate drug from your office favorites list. Either way will work. We'll just do a drug search here real quick, and I'll search for Allegra. So there's our Allegra Allergy. Billy tells us he's taking the 180 milligram tablet version of that. So we'll go ahead and select that once. And then down here in our prescription pad, I'll just come in here to the SIG section, and I'll just say that he's taking this Allegra Allergy once every day as needed. So I'll put in 1 Q day. And here PRN I'll put in into the free form box. And then what you'll want to make sure you do in the case that you're entering in patient reported or historical medications, you'll want to come down and make sure in this dispense section, you'll want to come down here and click on this history checkbox to mark this as patient reported or historical medication. Okay. So then from here, I'm just going to close out of this window. I've entered in enough information here about this particular patient-reported medication. So I'm going to go ahead and actually save this to his chart now by clicking our Save button. Okay. And at this point, we've added the medication to Billy's medication list. And since it is in the status of current or new, this medication and this patient are now meeting the med list objective for Meaningful Use Stage 1. Okay. So that's all you need to do for that. So we'll go ahead and jump back to our dashboard again. Take a look at our next objective, which is smoking status. So we'll go ahead and click on the smoking status box here next to pull that up. So what this objective is basically stating is that for at least 50% of the patients you see during your 90-day reporting period, you need to capture smoking status for at least 50% of those patients. So for most of you, where you'll actually capture this is within the History chart tab in the EMR. So if we go back to the EMR here real quick, I'll collapse that column back down. So on your right-hand side of the screen, you've got a chart tab called History. You'll just want to click on that once. For most of you, you should be capturing the smoking status within the Social History section of your History template. So if we go in here to the Social History section, you should have a status drop-down box there in your History of Tobacco Use section. So you just want to click on that and then select the appropriate status. Okay. There are two new options in the list. For those of you who have attested for stage 1 of meaningful use before, those two new options are this heavy tobacco smoker and light tobacco smoker. So those are brand new to your list of options. We'll go ahead and say that Billy here was never a smoker, and then we'll go ahead and want to save that to the patient's chart as well. Okay? So this is all you need to do, and again, you just need to do that for 50% or more of all patients you see during your 90-day reporting period. Okay? So we'll go ahead and jump back to our report section, our provider dashboard, and we'll kind of continue on with our core objectives. The next objective you see here in our list is the E-prescribe objective. So we'll go ahead and click on that. So what this particular objective states is that for 40% of all prescriptions that were written by the provider during the reporting period, 40% or more of all the prescriptions that you write need to be sent electronically to the pharmacy. Okay? Now there are two separate exclusions that some of you may meet where you would potentially not have to meet this E-prescribe objective. So if you are a provider who writes fewer than 100 prescriptions during the EHR reporting period, you will be excluded from having to meet this E-prescribe objective. Okay? Another exclusion that you may meet is that if you are a provider who does not have a pharmacy within your organization, or there are no pharmacies that accept electronic prescriptions within 10 miles of your practice location at the start of your EHR reporting period. So if either of those two situations fit for you as a provider, you will be excluded or excused from having to meet the E-prescribe objective. Otherwise, 40% or more of all prescriptions you write during the 90-day reporting period need to be sent electronically to the pharmacy. Okay? And again, you'll handle that by going into the EMR, going to the prescriptions chart tab, writing your prescription, making sure you select a pharmacy that is active to send that prescription to, and then sending it electronically to that pharmacy. Okay? So that's all you need to do there for E-prescribe. The next objective underneath that is an objective called CPOE. And just for those of you who do not know what that stands for, CPOE stands for Computerized Provider Order Entry. It's basically just a fancy way of saying that you're sending prescriptions and other types of orders electronically and not doing them on paper anymore. Okay? So the CPOE objective, what this basically states, it kind of works hand in hand with the E-prescribe objective just a little bit. So here on the CPOE objective, what you want to pay attention to is in the upper left-hand corner are there actually two different tabs. Okay? There's tab 1 and there's tab 2. Please note that only one of the two tabs needs to be met in order for you to meet the CPOE objective as a whole. So you do not have to be meeting both tab 1 and tab 2. It can be either tab 1 or tab 2. So either one of those, as long as you're meeting one of them, you'll meet the CPOE objective. Okay? What tab number 1 is stating is that for at least 30% of all patients seen during the reporting period need to have at least one medication in their medication list that is not marked as patient reported. Okay? So basically, as long as 30% or more of the patients you see during the reporting period have at least one medication that you've electronically sent or printed out of our system, that patient will then basically meet this objective. Okay? So if you're e-prescribing out of our system or doing a lot of printing out of our system, you should meet this tab 1 here, the CPOE objective, just fine. So tab number 2 of the CPOE objective is basically stating that for 30% or more of all medications that were written by the provider during the reporting period need to be not marked as patient reported. Okay, so essentially the difference between tab 2 and tab 1 is tab 2 is it's basically doing a calculation based on the total number of prescriptions you're writing during the period, whereas tab number 1 is looking at the total number of patients that you were seeing during the period. Okay. The next objective we have is for decision support. So for decision support, this one is actually already lit up in green for us, but if it's not lit up in green for you, as it shouldn't be when you first start out, is when you click on decision support, basically what this is stating is that for your entire EHR reporting period, you need to set up at least one clinical decision support criteria and save that within the iReport section of the application. Okay? So essentially what you need to do here for decision support to get that set up is you need to run an iReport to locate a certain segment of your patient population. So for example, you need to look for all of your diabetic patients or all of your hypertensive patients and then set up a clinical decision support rule in the system so that whenever you open one of those patients' charts, you'll sort of be alerted that, hey, this patient is diabetic. Make sure you're doing X, Y, and Z to ensure proper care. Okay? So what you'll need to do to set up a decision support rule in our system is you'll first want to go into reports. And if you're looking at the provider dashboard, you're already in reports. If you're not looking at the dashboard, you'll just want to click first here on this reports button in the lower left-hand corner. Once you're inside of reports, you'll then want to scroll through your list of options here on the left, and underneath the EMR heading, you have this option here called iReport. So you'll want to click on that once, and from here, this is where we'll actually set up the iReport itself. So the first thing I usually recommend you do when you're running our iReport or setting up the clinical decision support rules is the first thing you want to do is set up your patient search column. So once we ultimately run the report and we're looking at our results, by setting up the patient search columns, that's basically us deciding what information we want to see in the results. So we'll go ahead and click here on patient search columns, and basically from here you have a patient demographics file cabinet, patient setup drawer that you'll want to click on, and then I usually start off in the patient information folder. Okay? So what this is basically doing is it's allowing us to pick and choose which fields from the patient demographics window in the system, what information from there we want to see in the results. Okay? So by default, our system is going to automatically pull in every patient's chart number into the results. If you also want to see every patient's first and last name, for example, you want to click on first and last name and then select this blue arrow pointing to the right to add those to our patient search columns. Okay? From here, if you wanted to add in maybe the patient's date of birth and their current age, what we can do to do that is we can come back here to the far left-hand column and select additional information, and then we'll go ahead and select birth date and add that in, and then we'll select age and years to add that in as well. Once you set up all of your patient search columns, you'll just want to click OK. From here, the next thing we'll want to do is actually set up our query or our search. So if we want to search, for example, for all of our diabetic patients, so all of our patients who have an ICD-9 code of 250.00 on their problem list, what we'll want to do to set that up is basically come down here in the middle of the screen, click on our black plus sign button. From here, you'll want to find here in the lower, on the left-hand side, you'll want to click on the problem list file cabinet, the problem list drawer, and the active folder. And then what I usually do is I'll search by diagnosis code. So I'll click on diagnosis code, and I want a diagnosis code equal to, and then I'll just need to find 250.00 here on my right-hand side. So we'll select 250.00, click apply, and then close. And then from here, all I need to do to actually execute or run this search is here in the middle right-hand side of the screen, click on our button for search for patients. And at that point in time, our system will pull up here at the very bottom of the screen a list of all of the patients who have that 250.00 currently on their problem list chart tab in their chart in the EMR. So these are all of my diabetic patients. From here, to save this as a clinical decision support rule, once you've run the report and see the results, to save this, you just want to click on your purple Save button here in the upper left-hand corner once. And then what you want to make sure you're doing is here across the very top, you want to make sure you select to save this as a decision support. Okay? And then from here, just give this a description. So I'll just say this is our diabetic 250.00 patients. And then the alert message, that's where you have the ability to basically fill in, whenever you pull up a diabetic patient's chart, what alert message or sort of reminder do you want to give yourself so that you're ensuring that you're taking the necessary steps or ordering the necessary tests or labs to basically treat this patient in the best way. Okay? So we'll just say that, in the alert message, we'll just put in make sure, order all needed labs and tests. Okay? And then we'll just click OK from there to fully save that. And at this point, once you've gone ahead and run the decision support and saved it as a decision support rule in the system, at this point in time, you're basically going to be fully set up, and you'll basically, when you go back to your provider dashboard, you should now see at that point your decision support button lit up in green for all of your providers. Okay. So that is decision support. So the next objective we'll take a look at is timely access. So I'll go ahead and click on our timely access button once, and we'll take a look at what we've got going on here. So the first thing you'll want to pay attention to on timely access, or kind of notice about it, is that it hasn't actually been moved from the menu set into the core objective list starting in 2014. So from 2011 to 2013, this timely access objective lived in the menu set, therefore making it an optional objective. For 2014 and moving forward, timely access is now a core objective, meaning it must be met in order for you to successfully attest for meaningful use. Okay? The next thing you'll want to kind of notice here about timely access is it is broken up into two tabs. Okay? And both of these tabs must be met in order for you to meet the timely access objective overall. Okay? So tab 1 of the timely access objective has to deal with basically granting or giving the patient the ability to set up a patient portal or My Medical Locker account. Okay? So this basically, tab 1 is essentially pretty much the same as it was for the years 2011 through 2013, where you're basically providing the appropriate information that the patient would need to basically be able to set up a My Medical Locker or patient portal account. So the way that's kind of changed a little bit in our system is that what you'll be able to do now as a part of the checkout process is you'll not only be able to print out what's called a clinical summary, which we'll get to in just a second, but our system is going to automatically queue up for you a My Medical Locker account setup letter, which once you print that out of the system, that will basically qualify the patient for meeting tab 1 here of the timely access objective. Okay? So essentially what you need to do for tab 1 is when you go into the iScheduler and you check a patient out. So I'll go ahead and go into the iScheduler, and we've got our patient on the schedule here for 2 o'clock. We'll say he's ready to get checked out. So I'll right-click on his appointment, and I'll select Checked Out. Okay? When I do that, I'm going to automatically get this quick pay window. It's going to automatically pop up here on my screen. Okay? When that happens, you're going to get your validation check that's going to run. Okay? And then the main thing you'll need to worry about here in the quick pay window at checkout is, of course, if you need to document receiving a copay, you do all of that. But then when it comes time to print off any documents, where you'll want to go from here is once you got your quick pay window pulled up, you'll want to click on this Print Queue tab here in the upper right-hand corner. So click once on that. So what's going to basically pop up here for you automatically is our system is going to automatically queue up not only a clinical summary to print out for a patient, which we'll go over in just a second, but then you're also going to get this My Medical Locker welcome letter as well. Okay? And once you've printed this My Medical Locker welcome letter out of the system and give it to the patient, that patient will then meet tab number 1 of the timely access objective. Okay? Just so you know what this My Medical Locker welcome letter is, it's essentially an informational letter that's going to literally walk the patient through step by step where they need to go and what they need to do to set up a patient portal or My Medical Locker account. Okay? And that is basically the first step of this objective. But just know once you print this letter out for the patient, at that point the patient is going to meet tab number 1 for timely access. To meet tab number 2, there's basically some additional steps that the patient needs to get to, and I'll go over that here in just a second. Okay? But again, for tab 1 of timely access, you just need to make sure you're printing out this My Medical Locker welcome letter for your patients and giving that letter to them so that they can go ahead and on their own actually set up their My Medical Locker account. Okay. So we'll jump back into reports, into the dashboard, and take a look at that. So again, that is tab number 1, and you basically need to do that for at least 50% of the patients you see during your 90-day reporting period. So at least 50% of the patients, you need to print out that My Medical Locker welcome letter at checkout. Okay. From there, for tab number 2 of timely access, what this is basically stating is that of the patients who you print out that My Medical Locker welcome letter to, okay, and give that to them, 5% of those patients need to go out and actually create that My Medical Locker account, and then once they've done that, they need to connect to your practice and then view online or download or transmit to a third party their clinical summary from My Medical Locker. Okay? So basically the way that'll work is that the patient, they'll basically read the instructions on the My Medical Locker welcome letter. They'll be instructed on how to go out and where to go to set up that My Medical Locker account. They will then connect to your practice, and then from there, once they are connected to your practice, they'll be able to pull or view that clinical summary from their patient portal or My Medical Locker account. So once the patient has done that, they'll basically meet tab number 2 of the timely access objective. So again, that's 5% of the patients who you give that My Medical Locker letter to. 5% of those patients or more need to actually create that My Medical Locker account and then view their clinical summary from their My Medical Locker. Okay. I won't get into the details and walk you through how to do that here on the video today, but just know that you'll absolutely be able to, again, search through our OfficeEMR knowledge base for the timely access stage 1 objective, and from there you'll literally get a quick use guide that'll walk you through step by step what you'll need to do to print the letter off, and then what the patient will need to do to actually create their My Medical Locker account and then view their clinical summary. The next objective we'll take a look at here is our final core objective, which is clinical summary. So we'll go ahead and click on our clinical summary button to pull this up, and we'll take a look at what's going on here. So for the clinical summary objective, what you basically need to do is for at least 50% of the patients you see during your 90-day reporting period, you need to print off that clinical summary document that we just saw a second ago in the quick pay window. You'll need to print that clinical summary off and give it to the patient within 3 days of the patient's office visit. Okay? So again, what you'll need to do that is we jump back into the iScheduler, and when you check the patient out, you again get that quick pay window. It's going to automatically pop up for you, and you'll just want to go to your Print Queue tab in the upper right-hand corner, and then select your clinical summary and click Print here in the lower right-hand corner to print that off to give to the patient. Okay? And again, you'll need to print that clinical summary off for at least 50% of the patients you see during the reporting period. After you've printed off that clinical summary, I imagine you'd probably print off that My Medical Locker welcome letter at the same time as well. So once you've printed off any and all of those documents, you just want to close out of the quick pay window to be completely finished with that patient. Okay? And that is the clinical summary objective. and that is the final core measure that you'll need to meet for Meaningful Use Stage 1 starting in 2014. Okay? So again, just to recap the core measures there, you'll need to meet every single one of the core measures you see listed unless you meet or qualify for one of the exclusions for any of those measures. So the very first objective we'll take a look at is called RX Formulary. And just like RX Interaction, RX Formulary is actually another one of those sort of freebies that you'll get automatically by just using our system. So there's a company setting that needs to be turned on for the entire reporting period, but just know by default every single database is going to have this setting turned on for you automatically. So there should be nothing that you need to do. However, in the instance where if you look at your provider dashboard and the RX formulary objective is not turned green for you, just contact the iSalus support staff and they'll be able to quickly turn the setting on for you so that you are meeting it for your reporting period. Okay, so again, RX formulary, there's nothing special you need to do. Just by using your system, you're going to automatically meet this objective. The next objective we have is called MedRec, or Med Reconciliation. So what this basically means or requires is that for 50% or more of the patients who have been transitioned to your care, and from those patients who have had a transition of summary care file uploaded into the system from their previous or referring provider certified EHR, you basically run the med reconciliation on those patients. So again, a patient will only fall into the denominator of this objective if that transition summary care file has been loaded into OfficeEMR from their other doctor's certified EHR. If that file is never uploaded into our system, that new patient or patient who's transitioned into your care, they're not going to fall into the denominator. So that transition summary care file being uploaded into OfficeEMR, that is the catalyst or the reason why a patient will fall into the denominator for this objective. If that particular situation plays out and you do have that, what you'll then need to do in order to kind of successfully meet or perform that med reconciliation for the patient is you'll just want to go into the EMR, into that patient's chart. Okay. And if we go back to the summary chart tab for that patient, what you'll want to do is here in the lower left-hand corner of the timeline, you'll want to click on this notepad and pencil button there to pull up the reconciliation window. At this point in time, if we had actually imported that transition summary care file into the system for this patient, we would basically at this point see a list of not only the allergies, medications, and problems we already have on file in the patient's chart in OfficeEMR, we would also see a list of any allergies, medications, and problems that were included in that transition summary care file from the patient's other provider who sent the patient to you. And then in this window that we just pulled up here, this is where you basically would be able to reconcile these three pieces of information. So you'd be able to see, all right, it looks like this patient is currently allergic to amoxicillin, and if there were any other allergies in that transition summary care file, you would see those listed here in the allergen section, and you would be able to decide whether you wanted to keep or not keep those particular allergies. And you'd be able to do the same thing for your medications, same thing for your chronic problems. So then you basically be able to electronically reconcile and then add into, if needed, those three pieces of information right into the patient's chart. Okay? So then all you need to really do from here is once you've kind of reconciled everything, click on your Save button in the lower right-hand corner to save that and close the window. And at that point in time, that patient will then meet the med reconciliation objective for meaningful use. Okay? Again, if you have any questions on that or you need to see that again, you absolutely can contact the iSalus support team, or again, you can use your OfficeEMR knowledge base to search for MU Stage 1 and then locate the med reconciliation quick use guide to walk you through these steps in a little bit more detail. So we'll go ahead and jump back to our provider dashboard and continue looking at our menu set objectives. The next objective we have there is called lab results. If we click on the lab results window, or button I should say, you'll get the window that'll pop up the information for this particular objective. So the lab results objective is essentially stating that for 40% or more of all lab orders that were placed by the provider during the reporting period need to have associated with them results that are either in a positive, negative, or numeric format. Okay? So essentially the way this will have to work in our system is you'll need to have a lab interface already established and set up with your lab company. So OfficeEMR and iSalus Healthcare, we already have established interfaces set up with companies like LabCorp, Mid-America, Quest Diagnostics, MedLab, and several others. So if you currently do not have a lab interface set up with us and would like to go after this measure, you'll just make sure you want to reach out to the iSalus Healthcare support team to get that process started. If you do already have an interface set up, this measure should be very simple and easy for you to meet, especially if you have basically all of your labs coming in with results that are electronic. Okay? But again, if you don't have the interface set up, most likely you're not going to be able to go after this particular objective. And if you do want to go after it, you want to make sure you contact the iSalus support team to get the process started of setting up that lab interface. The next objective we have is called patient education. If we click on that, this should be a pretty easy one for a lot of you to meet. What it's basically stating is that for 10% or more of all patients you see during the reporting period, you need to dispense out of OfficeEMR to those patients an educational material or document of some sort. So the way you basically in OfficeEMR dispense the patient education material out of the system is through the patient education chart tab in the EMR. So we'll go ahead and jump into the EMR here real quick. And on your right-hand side of the screen, you should have a chart tab called Patient Education. So you just want to click on that once. And then what will basically happen for you is we actually have a company setting that we can turn on and should be turned off for you automatically, which will basically automatically look at the patient's problem list, current medication list, and allergies. And then based on those three pieces of information, our system will be able to recommend to you certain pieces of educational material. So you can see there our system is recommending that I print off an education material on Allergy allergy and benign hypertension. So you can absolutely click on the check boxes for those two items and then click your print button here at the very top of the screen to then print those documents out and give those to the patient. At that point, this patient would then fall into that 10% or more of patients you've seen who you dispense educational materials out of our system for. Okay? If you do not want to use the recommended educational materials but rather import into the system your own educational documents, you absolutely have the ability to do that, at which point you'll be able to search for those documents in your search box at the top of the screen and then print them off in the same manner. Okay? So again, 10% or more of the patients you see during the reporting period, you need to print off the educational materials here from this patient education chart tab in the EMR. So the next objective we have on the menu set is called patient reminders. So we'll go ahead and click on that button to pull this window up. So the patient reminders objective, what this basically states is that for 20% or more of all of your patients who are 65 years and older or 5 years and younger, they were sent an appropriate reminder during the EHR reporting period. So basically the way this will work is in our system within reports, you'll want to set up an iReport to search for all of the patients 65 and older or 5 and younger who were seen during your EHR reporting period or who will be seen during your EHR reporting period, and then you'll need to send them an appropriate reminder out of our system. The most common way this is accomplished is through the form of a letter. So what we can do is we can set up in your database an appointment reminder letter that you can word however you would like, and then basically from there you would be able to search for all of these patients and then generate and print at one time a letter for each and every one of those patients. Okay. So the way that'll basically work is through iReports. So you'd want to set up an iReport in the system to search for all of your patients 65 and older or 5 years and younger, and then basically set in another search criteria to find all of those patients who were seen during your reporting period, and then queue up a letter to print off for them. So what we'll go ahead and do is I will go ahead and hop into iReports. So on the left-hand side, we'll click on iReport. Okay. And since we've got pulled up on the screen now, basically that decision support rule, to clear that out and do a brand new iReport, I'm just going to click on my new button here once. Okay. And I'll go ahead and say, yes, I wish to clear the search criteria. So we'll go ahead and do that. Okay. So from here, again, the first thing you want to do when doing an iReport is set up your patient search columns. So I'll go ahead and select, we'll just do chart number and first and last name maybe, and click OK. And then from here, what we want to do is basically first search for all of our patients who are 65 and over, who are going to be seen during the reporting period, and then search for all of our patients 5 years and younger, who will be seen during their EHR reporting period. So the quickest and easiest way to kind of do that is we'll have to set this up through two separate criteria. So the first criteria is going to be all of our patients 65 and over who are going to be seen during the EHR reporting period. And then we're going to set up criteria number 2 to be all the patients 5 years and younger who were seen during the reporting period. And then we'll search for those patients, and then I'll show you how to queue up a reminder letter to print off for everybody at once. So for criteria number 1, we're going to want to search for all of our patients 65 years and older who are seen during our EHR reporting period. So I'm going to click on my black plus sign button here to search and enter in a new search field. And what I'm going to do basically from here is I'm going to find or locate the patient demographics file cabinet, patient setup drawer, and additional information folder. And I'm looking for all patients first here on criteria number 1 who are 65 years and older. Okay, so we're going to select years and age greater than or equal to 65. And then click apply. All right? And then the next thing we need to do from here is basically search for all of these patients who are 65 and older who are seen for an appointment during our EHR reporting period. So what I'm going to do from here is I'm going to go to the appointment file cabinet, appointment drawer, appointment folder, and I'll basically want to put in a start time equal to, okay, actually sorry, we'll want to do a start time greater than or equal to April 1st, 2014. Okay. And then we'll hit apply. And then what we want to do from here is go back to do an appointment, start time less than or equal to, and we'll want to go 90 days out from there. I believe that should be somewhere around June 30th, right? And then we'll hit apply and close, all right? So we got criteria number 1 set up. And then we'll want to basically from here search for criteria number 2. So we'll set that up here. But just to kind of show you what we've got so far, what we'll do is we'll just search for everything in criteria 1. So I'll click on that search for patients window there. And there we go. We've kind of got 3 patients. So I guess between the time frame of April 1st and June 30th are 65 years and over. Okay, so we got 3 patients there. Now we'll go ahead and search for our 5-year-old and younger who have a patient who have an appointment during that same time frame. So again, I'll click on my black plus sign, click on my appointment folder. We'll go ahead and set this up here first. So appointment start time greater than or equal to April 1st, 2014. Apply. And then appointment start time less than or equal to June 30th, 2014. And then we're looking for all of our patients 5 years old and younger. So we'll go to patient demographics, additional information, age and years, less than or equal to 5. Hit apply and then close. All right. So now we've got both of our criteria set up. So what's going to happen Now is when I hit search, it's going to search for all of my patients 65 and older who have an appointment during that time frame, or all of my patients 5 years and younger who have an appointment during that time frame. So we'll go ahead and hit search and see if we get anybody else in there. Looks like we got one additional patient. So we've got 4 patients now who have appointments that fall into that time frame, and these patients are either 65 and older or 5 and younger. So then from here, to generate and print off that appointment reminder letter for the patients, we'll just click on the Send Reminder button. Here on the left-hand side, you would basically locate and find that appointment reminder letter in the list. Since we don't have one currently set up, we'll just kind of pretend that Kim's letter is that appointment reminder letter. And then here in the notes, we'll just type in there that this is an appointment reminder letter. And then you click OK. And at that point, our system is going to pull up a second window here for you, and it's going to queue up for you to print a letter for each of those patients. You then, at this point, be able to hit your print button in the upper left-hand corner and print off a letter for each of these patients at one time. So you won't have to kind of do that for everyone individually. You'll be able to knock that out at one time. And then once you printed those off, you just close out of that window. And at that point, you would have met the patient reminder's objective for meaningful use. Okay? And again, the patient reminders, you only need to print off that letter for 20% of those patients. But if you run that report and you find all of those patients and you print off the letter for everybody, you're either going to be at 100% or pretty darn close to it. So you should be able to definitely meet that objective if you go the route of printing that off for everybody at once. The next objective we have is called Exchange Summary Care. What this basically means is that for 50% or more of the patients you see during the reporting period who you've placed a referral order for, you'll need to in turn generate and send out or export out of our system a summary of care document. Okay? So a patient will fall into the denominator here for this objective if you've placed a referral order in the system in the EMR out of the order entry chart tab. And then in order to kind of successfully meet this objective for any of those patients, what you'll want to do is come in here to reports, which we're already at. Okay? And then what you'll want to do is basically come in here underneath the EMR heading and click where it says Summary of Care. You want to click on Summary of Care, and then in the upper left-hand corner, you'll want to click here on this button that says Transition of Care / Referral. At that point in time, you'll be able to fill in the information, to fill in who this document was from, who you want to send it to, what's called a direct email address. You'd enter that in there, and then select the patient you want to do it for, the reason, and then you'd be able to send or export that document. Okay? I won't walk you through that at this point here on our training, but just know if you do have additional information on this particular objective, how you would do it, where you would find a direct email address, how to even set this up. Again, you'd be able to reference our quick use guides in the system or contact the iSalus support team. But essentially, this is where you'll go to do that. Okay. And you just need to do that again for 50% or more of the patients who you place a referral order for. The next objective we'll take a look at is called Patient List. This is usually a pretty quick and easy objective that everyone should be able to meet. Basically, all you have to do here for the Patient List objective is just one time at one point during your 90-day reporting period, you need to generate a disease management report based on problem list criteria and then save that in the system. Okay? So the way you would do that is you want to come into reports, which again, we're already in there. If you're not in reports, you just click on your reports button in the lower left-hand corner to get here. And then on the left-hand side here in your list of options, you want to scroll down towards the bottom, and underneath the Meaningful Use heading above Provider Dashboard, you'll want to click where it says Disease Management. Right. The screen here for the Disease Management reports is pretty similar to iReport, so it has a pretty similar look and feel, and it works in pretty much the exact same way. So again, the first thing you'd want to do is set up your patient search column. So what you want to see in the results, again, we'll go ahead and I'll just kind of use some basic demographic information. So we'll just select maybe first and last name and chart number, and be done with it. And then the next thing you have to do is you basically, again, have to run this disease management report based on problem list criteria. So what that basically means is we literally need to run a report to find a list of patients who have diabetes or have hypertension or some other chronic illness. So we'll go ahead and click on our black plus sign down the middle of the screen to select what we want to search for. So I'll go ahead and click on our problem list cabinet, problem list drawer, active folder, and I'll just search by the diagnosis code that is equal to, and we'll just say we want to search for all of our patients. Oh, let's find something a little more interesting than diabetes. We'll just say we'll look for benign hypertension patients. So our 401.1. We'll click on that, click apply, and then I'm just going to hit search here in the middle right portion of the screen. And there are all of our patients who have that 401.1 on their problem list in the EMR. From here, all you need to do now that you've run the report is save it. So we'll click on our purple save button in the upper left-hand corner once, give that a description. Save as new, and click OK. And at that point, you'll basically are meeting that objective, and that's all you need to do. So you just have to run this report at some point during your 90-day reporting period, but once you've run it, you'll be meeting that objective for meaningful use. Okay, so it's just a one-time thing you need to do. And then the last two objectives we'll talk about here today are on the menu set are the immunization registry and public health surveillance. So we'll start off with the immunization registry. So all you need to do for stage 1 with the meaningful use in 2014 is you basically have to perform at least one test of the certified EHR's technology's ability to submit electronic immunization data to your state registry. Okay? So it's just a one-time test that you need to do out of our system. And the way you'll do that is through the immunization export tool within reports. Okay? So all you need to do to export the immunization file that you need is to come into reports, which again we're already in there, and we'll click on immunization export here at the very bottom of your list on the left underneath public health. So I'll click on immunization export. And then really from here all you need to do is if you want to search for all of the patients in the system or in your database who you've documented immunizations for, whether they're historical immunizations or immunizations you actually have given to the patient, it doesn't matter. To basically search for all the patients where you've documented some immunization information, you'll just need to click on the magnifying glass here in the search box in the upper left-hand corner. What you may want to do before you hit search is you may want to increase your maximum rows from 50 to maybe 500 or 5,000 based on how many immunizations you typically give during a 90-day period. So you want to increase your max rows, hit your search button there. In our case, actually, it looks like we didn't need to do that since we only have 3 patients. But from here, once you kind of see a list of all of your patients, what you'll need to do is basically run through and select this checkbox here for each of those rows that you want to include in the export file. In our case, since we only see 3 checkboxes, we only have 3 rows in our results, it's not really too big of a deal for us to go through and click on each of those checkboxes individually. Okay? Now, if you happen to run this report and you see you have 500, 600, 1,000 rows in your results, you probably don't want to spend a half hour, an hour going through and clicking on all those checkboxes. So what you can do in that case, or in the case where you only have 3 rows, it doesn't matter, you'll just want to do a right click anywhere here on the screen and then select all. And that'll go through and at one click, or I guess a couple clicks, select all your rows for you automatically. And then from here you'll just need to click on this export button at the very top of the screen to export that file. Once that file has been exported, our system will let you know where on your computer this file has been located, and it's basically from there your responsibility to get this file uploaded to your state immunization registry. Okay? But once you've exported that file out of our system, that's all you need to do that. And then again, from there you need to make sure that file ends up in the appropriate person's hands to get that fully uploaded to your state immunization registry. Okay? And again, that's just a one-time test that you need to do for stage 1 of meaningful use. You don't need to do that on a weekly, daily, monthly, or yearly basis or anything like that. You absolutely can, but again, to kind of meet the objective for meaningful use, you just have to do this once. But absolutely, if you like the tool and you want to use it on a frequent basis, you can absolutely do that. So the next objective is our very last objective that we'll talk about here today, and it's for public health surveillance. So we'll go ahead and click on our public health surveillance button, and we'll take a look at what's going on here. So this particular public health surveillance objective really only makes sense for any clients, or if you're an urgent care or an emergency care facility, this really only makes sense for you. For more of our kind of standard practices, this really doesn't make sense for you, because the intention behind this objective as a whole is to basically used to kind of help track in real time any particular disease outbreaks and try to minimize those outbreaks and those risks that may be involved there. So if you are an emergency care or an urgent care facility and you'd like to go after this particular public health surveillance objective, what you'll want to do is you'll just want to contact the iSalus healthcare support team as soon as possible, and we'll basically work with you to get everything that you need to have set up in your database, and we'll at that point walk you through the steps you'll need to take to get the appropriate data that you need to export out of our system and sent to your local public health agency. To your public health agencies, we'll get that all set up for you. So again, you just want to contact the iSalus healthcare support team. We'll work with you to get everything set up, and we'll walk you through how to export that data to your public health agencies. Otherwise, again, for most of you, you'll probably just go after the immunization registry objective, since again here in the menu set you need to attest for either one of the immunization registry or public health surveillance. You have to attest for one of those two. Again, most of you will do immunization registry. If you are ER, emergency care, urgent care facility, you can absolutely go after public health surveillance if you want to, and then after you've attested for either of these two, you'll then have to attest successfully for 4 others here on the menu set. And with that being said, that is all of the meaningful use stage 1 objectives for 2014 and onward. Basically from here, if you have any questions, again, your first line of defense is to use the OfficeEMR knowledge base to search for MU stage 1, and then walk through and print off maybe all the quick use guides for each of these objectives, which again will walk you through step by step what you need to do within OfficeEMR to meet those objectives. And then from there, if you do have any other additional questions, you can absolutely reach out to the iSalus healthcare support team to get those questions or issues addressed. From here, we'll go ahead and wish you guys the best of luck. And again, if you do have any questions, feel free to contact us at any time.